Pregnancy is an exciting time for couples, but it can also be a time of uncertainty, especially when it comes to the health of unborn child. Prenatal testing and genetic counseling have become an increasingly important aspect of prenatal care, allowing parents to learn about their baby's health and potential risks before birth. In this video, we'll dive into what prenatal testing and genetic counseling are, what they involve, and why they are important. What is prenatal testing? Prenatal testing is a type of medical testing that is performed during pregnancy to evaluate the health of the developing fetus. There are a variety of prenatal tests available, each with its own unique purpose and benefits. Some of the most common prenatal tests include ultrasound, blood tests, and amniocentesis. Ultrasound is a non-invasive prenatal test that uses high-frequency sound waves to create images of developing fetus. This test is often performed during the first trimester to confirm the pregnancy and again during the second trimester to check for any physical abnormalities. Blood tests, on the other hand, are used to screen for certain genetic disorders that could affect the baby. This test can be performed as early as the first trimester and can detect conditions such as Down syndrome, spina bifida, and neural tube defects. Amniocentesis is a more invasive prenatal test that involves the removal of a small amount of amniotic fluid from the uterus. This test is typically performed during the second trimester and can detect a wide range of genetic disorders including chromosomal abnormalities and neural tube defects. What is genetic counseling? Genetic counseling is a specialized medical service that is designed to help couples who are at a risk of having a child with a genetic disorder. This service is typically offered to couples who have a family history of a genetic disorder or who have previously had a child with a genetic disorder. During genetic counseling, a trained genetic counselor will review the couple's medical history, perform a risk assessment, and discuss the options available for prenatal testing. The genetic counselor may also provide information on the potential risk and benefit of various testing options and offer emotional support throughout the process. Genetic counseling is an important part of prenatal care because it can help couples make informed decisions about their pregnancy and prepare for any potential risk. Genetic counseling is an important part of prenatal care because it can help couples make informed decisions about their pregnancy and prepare for any potential health issues that may arise. Why is prenatal testing and genetic counseling important? Prenatal testing and genetic counseling are important for a variety of reasons. Firstly, they can help identify potential health issues before birth, which can allow parents to prepare emotionally and make any necessary medical arrangements. Secondly, prenatal testing and genetic counseling can help couples make informed decisions about their pregnancy. For example, if a genetic disorder is detected, the couple may choose to continue with the pregnancy, terminate the pregnancy, or make preparations to care for a child with a genetic disorder. Finally, prenatal testing and genetic counseling can also help researchers better understand genetic disorders and develop new treatment and therapies. By studying the genetic makeup of fetuses and newborns, researchers can gain insights into the cause of genetic disorder and develop new ways to prevent or treat them. So in conclusion, prenatal testing and genetic counseling are important aspects of prenatal care that can help couples better understand their baby's health and potential risk. Whether you are considering starting a family or are already pregnant, it's important to discuss prenatal testing and genetic counseling with your healthcare provider to ensure that you are making informed decisions about your pregnancy. By learning more about these important medical services, you can take control of your pregnancy and ensure that you are doing everything possible to protect the health and well-being of your baby. It's important to remember that every pregnancy is different, and what works for one couple may not be the best option for another. That is why it is important to discuss your individual situation with your doctor and a genetic counselor to determine the best course of action for you.